Our next presenter is Dr. Paul Marik. He has written over 500 peer-reviewed journal articles, 80 book chapters, and authored 4 critical care books, and has been cited over 48,000 times in peer-reviewed publications. Dr. Marik is certainly one of those doctors who've been persecuted for treating patients.
The PALM study group investigated 4 drugs for the use of Ebola. The results were published December the 12th, 2019 in the New England Journal of Medicine. And that date is particularly important because that signaled the beginning of COVID. Remdesivir increased the risks of death and renal failure. It was such a toxic drug, the Data Safety Monitoring Board terminated the use of Remdesivir. The NIH and the Act 1 study enrolled patients in a study looking at Remdesivir for the treatment of COVID-19. The last patient was enrolled April 19, 2020. 10 days later, before the study had actually terminated, Dr. Fauci sat in the Oval Office of the White House and he said the trial was good news. What Dr. Fauci did not tell you was that the primary endpoint of the study was changed halfway during the study. We all know that is scientific misconduct. Because the study was not going to be positive, they changed the primary endpoint. They invented a bogus endpoint called time to recovery, which they showed in this study was statistically significant. And based on this bogus endpoint, Remdesivir was approved by the FDA on October the 20th, 2020.
The data shows that Remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery. It was 11 days compared to 15 days. This will be the standard of care.
Standard of practice is set by a number of physicians who have a large amount of conflicts of interest. The people who lead these guideline committee, they're on the take. But the problem is that people die.
So we would have normally waited several days until the data gets further, dot the I and cross the T. But the data are not going to change. Some of the numbers may change a little, but the conclusion will not change.
If Big Pharma does a study that shows that its drug is no good, it has the option of not publishing it.
If this was a study conducted in China, it was terminated early, and it failed to show any benefit for Remdesivir versus the standard of care.
Almost every single patient in this country is treated with the combination of Remdesivir and low-dose dexamethasone. But just to make the situation even more preposterous, the federal government will give hospitals a 20% bonus on the entire hospital bill if they prescribe Remdesivir to Medicare patients. The federal government is incentivizing hospitals to prescribe a medication which is toxic.
The hydroxychloroquine cocktail, it's about $20, right? Certainly no more than $50. Remdesivir, and we'll talk about that a little bit later in terms of the side effects of that, and the studies, the science behind that, costs over $3,000. Could that maybe be one of the reasons why all the effort is put on these more exotic therapeutics that cost thousands of dollars versus something that's off the shelf that costs $20?
We want to thank all the collaborators that have brought Remdesivir to this point, and that certainly includes NIH and Dr. Fauci.
He authorized Gilead's application for emergency use authorization. This was lightning speed in terms of getting something approved, and from clinical trial to getting it authorized from the FDA, it's been quite the speedy but also effective process.
The FDA has a huge history of drugs going into widespread use in the medical community for decades that have not been established on the basis of randomized controlled trials.
I mean, the fact that it's an existing drug, that helps.
But you still got to go through trials.
The FDA makes a decision which is sometimes totally independent of any finding by the advisory committee.
Dr. Rayford Brown chairs the FDA Opioid Advisory Committee. According to Dr. Brown, the FDA is putting the interests of big pharma ahead of public health. They're approving the painkiller OxyContin. The FDA didn't even require Purdue Pharma to undergo clinical trials.
Opioid company Purdue gave a lot of money to the doctors to say that, hey, if you are in pain, you can't get addicted. It's like, that actually wasn't true at all, but that's what I was taught in medical school. If you're in pain, you can't be addicted.
I'm quoting, the FDA has a lack of transparency and uses the advisory committees as cover.
The agencies turned a blind eye toward simple, cheap, possibly effective treatments that, by the way, created no harm.
According to the regulations, people who receive royalties are not required to divulge them even on their financial statement, according to the Bayh-Dole Act.
The hydroxychloroquine FDA Advisory Committee lists significant conflicts of interest. Some conflicts have not been properly disclosed.
Half of the chemotherapy drugs used in cancer were used without a randomized controlled trial. The antibiotics, amoxicillin, for example, that parents use with their children all the time, day in, day out, was never established with a randomized controlled trial before it was used.
China stopped the studies because they couldn't fully enroll them, because they stopped accruing cases in China because their epidemic had subsided.
This accidental admission that China has beaten the virus was brought to you by former FDA Commissioner Scott Gottlieb. Scott's a board member of the company Pfizer. 4 months after this interview, Pfizer announced it was manufacturing Gilead's very expensive Remdesivir. In 2019, Pfizer purchased a company called Mylan. Mylan used to make hydroxychloroquine in West Virginia, but after Pfizer got hold of it, they shut it down. In July of 2020, Mylan announced it would make the generic version of Remdesivir for Gilead. None of these conflicts of interest were disclosed by CNBC.
I don't know why people weren't more positive all along
about Remdesivir.
It does not work. That is the bottom line. It is an ineffective drug. It is highly toxic, not just for the kidneys, but also for the liver, and it shouldn't be used. Okay, it's just a failed drug. It was an antiviral agent that never had a good indication. Fauci figured, let's get this into use for COVID. And it was his steamrolling that got it onto the standard now hospital protocol that is being reimbursed by government premiums. The hospital get extra money if they use Remdesivir. This is horrific. This is truly centrally driven medical care, and it is so harmful. Doctors should not go along with it, but unfortunately, once you're in a hospital, you're an employee, and you either go along with it or you lose your job. Medical ethics out the window. We should never be doing anything harmful to patients. And here is a drug that is clearly harmful and has no benefit.
How much will you pay to live? Because the answer is everything.
The makers of the drug Remdesivir have set a price for the medication.
It's $3,200, but what you didn't say yet is that Health and Human Services has bought up the whole supply.
No treatment until you go to the hospital. Then your treatment are two things that are bound to kill you: ventilators and Remdesivir. And Tony Fauci knew that Remdesivir would kill you. It is homicide. And if you look, how does it kill people? Kidney failure, heart failure, and all organ collapse.
They rolled out Remdesivir onto a substantial number of patients for which we all saw it was killing the patients. And now it's the FDA-approved drug that is continuing to kill patients in the United States. As these patients get Remdesivir, they have a less than 25% chance of survival if they get more than 2 doses. Now they're rolling it out on children as well, and into the nursing homes or skilled nursing facilities as early intervention. And if you ask me, this isn't a hospital, this is a concentration camp. Absolutely it is.
Because my mom was murdered on October 25th at Baylor Hospital. She was given Remdesivir without our authority. We told them specifically not to give her Remdesivir. 5 days later, all of my mom's organs shut down. We showed them the studies. Over 30% of the people that were given Remdesivir in the studies died. We told the doctor, the infectious disease specialist, do not give my mom Remdesivir. Guess what they did? They gave her a 5-day cycle, and my mom is dead.
I'm so sorry, Mom. I love you Well, I just don't understand why I said I didn't want on Remdesivir when you guys put on Remdesivir. I don't know.
Just disease doctors, and she had already been on that and completed.
Yeah, but I'm talking about before the first day we were in there, I said we didn't want to do that. And you guys did that anyway.
So if you look at the studies right now,
Listen, I don't care about the studies. I asked you not to do something and you did it, okay? That's the problem.
The Food and Drug Administration is under the direct control of Congress. It's often the captive of the industry that it is supposed to regulate, because the industry, the drug industry, has a powerful lobbying effect on Congress.
This is our fault. We don't have the fortitude to kick pharmaceutical lobbyists outside of our congressional offices.